issues that affect you and your community. This is Local 12 Newsmakers.
Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. The Ohio primary will be held this Tuesday, March the 6th. We conclude our coverage this morning with the Republican race for Congress in the new Ohio 2nd Congressional District. The 2nd District slices into the eastern and central portions of Hamilton County and then stretches east along the river to include all or part of Claremont, Adams, Brown, Highland, Scioto, and Pike counties. There is a contest on the Democratic side between David Krikorian and William Smith from Pike County. This morning we will focus on the Republican primary. Gene Schmidt, the incumbent, has represented this district since 2005. We are recording on Friday morning and the Congresswoman is traveling with presidential candidate Rick Santorum in Chillicothe. To include her views, I interviewed Mrs. Schmidt on Wednesday from Washington and will include some of her comments in our discussion. On set this morning I am joined by the three other candidates on the ballot. Tony Brush grew up in Colorado, served in the Marine Corps, and moved to Claremont County in 2003. Mr. Brush works as a project manager at Tata Consulting Services. This is his first run for public office. Fred Kundrata grew up in Detroit, graduated from Bowling Green University, and enlisted in the Air Force. After flying in the first Gulf War, he served in various capacities, both on active and reserve service. Since 1997, he has worked as a commercial pilot. This is Mr. Kundrata's first run for public office. And Brad Wenstrup is an orthopedic surgeon with the Wellington Orthopedic and Sports Medicine Group. Since 1998, he has also served with the U.S. Army Reserve in the Medical Service Corps. In 2005, he was deployed for a year of active duty in Iraq. Dr. Wenstrup is still a member of the U.S. Army Reserve. He ran for mayor of Cincinnati in 2009. Welcome to Newsmakers. There is, by the way, one additional candidate here, Joe Green from Pike County. His name does not appear on the ballot, but he is an official write-in, which means that his votes will be counted. And I just want to recognize that there's another dynamic here as well. Let's begin, and Brad, you're a doctor, so let's begin with you. Okay. I'm making an assumption for all of you ultimately that you're going to win the seat in Congress. You're going to be the congressperson. That the Republicans are going to hold the House, maybe take the Senate and take the White House. And I'm assuming, therefore, one of the first things is to roll back the health care reform that Obama's and the Democrats passed. What do you say and what will you do for the 50 million Americans who do not have coverage under our current system and the Obama plan was attempting to cover? Is there an alternative for those people who weren't covered?
Well, I think there are alternatives, and one of the first things we have to look at is who's uninsured and who's actually uncared for, because there's a difference. For example, the New England Journal of Medicine did a study last year, and they did ghost calling to primary care doctors' offices. 66% that said they had Medicaid could not get an appointment because the doctor didn't take Medicaid. 11% of private insurance couldn't get an appointment. So the real issue is who's not being cared for, because you may have an insurance policy, and they estimate that it'll go to about 50% on Medicaid under the Obamacare plan. Well, then who's going to take care of them? And that's the real issue. So there are alternatives to make care more accessible, more affordable, and those are some of the things that we need to look at. Tort reform, competition across state lines for insurance. Competition always brings prices down. Paying with pre-tax dollars, health savings accounts, allowing small businesses to band together and to buy in bulk, or individuals to do the same thing. And on the doctor's end, doctors want to take care of everybody. They really do. But they can't afford to take it for nothing and not be able to pay their bills. But if they could get a tax break, for example, up to the level of Medicare reimbursement, that might be helpful too for those where it's a loss leader item for them, if you will.
Okay. Tony, what about you? What would be your view in this situation?
Well, I think my thought process is that right now we're trying to supplement people's health care. That money actually, citizens themselves haven't prioritized health care in their lives. If they haven't prioritized health care in their lives, then I don't see that it's the government's job to do so. If we provide health care for people who already have cable TV, cell phones, and a lot of what many of us have to budget in our personal lives, then I think we're overstepping our bounds. I think the long term,
You don't think that there are a lot of people out there who are working very low-paying jobs, maybe multiple jobs, who none of that is, none of those jobs give them the benefits? You don't think there are people who are really trying to do the right thing,
I'm not going to say there's no people.
but you don't think there are many?
I don't think there are many. I really don't. And that might seem harsh. I'm okay. I'm speaking from my heart
Right.
here. I really think that there are some small business people that are struggling. And I think healthcare costs are expensive. But for me, the long-term plan, because we have to realize that medicine is a business, right? And because of the way the insurance program works right now, we don't negotiate. We get the lowest deductible usually we can get, and then we don't care what the costs are. So the way that we're set up right now isn't a free market. But beyond that, long term, the way that we keep healthcare costs down are at least through leadership, trying to make sure that healthy people stay healthy. So I would say things like HSAs. I'm a big fan of HSAs. HSAs, though, should be, in my opinion, reimbursing for health club memberships, reimbursing for athletic equipment.
So it's preventative care. And
That is by
welfare.
far the cheapest way to handle long-term medical costs.
Fred, on healthcare, where are you on this?
Yeah, Dan, no problem. I totally agree with Brad. We're on the same page regarding how to allocate resources in regards to the uninsured versus uncared for, and we need to make that differentiation from the start. I have included in my flight plan for jobs, and I'm the only one here with a published jobs plan that talks about health care, specifically with some of the ideas that I plan to implement in Washington that have to do with tort reform, coverage, and as well for the healthcare hub that I've envisioned for Cincinnati. We have such a great facility up there at University of Cincinnati Medical Center and Children's Hospital. We need to harness that and promote it globally in terms of bringing people into our hub for better jobs for the district. I'm a firm believer that we're going to have to take a good, firm look at the allocation of resources. Brad here has talked routinely about watching out for the plight of doctors on the campaign trail. I'm concerned that that could skew his decision-making in Washington when it comes to how we're going to allocate resources between the professionals and the patients.
Okay. I want to hear what the Congresswoman had to say. I asked her the same question. Let's listen to what Gene Schmidt had to say.
When we had this whole debate a few years ago, we actually talked about our plan. It was, of course, silenced by the folks that wanted to champion a universal health care. But the pathway forward is a multiple approach to make it a patient-centered environment, which we truly believe will lower the cost of health care, generally speaking. But for those that are at risk, what we want to do is put a risk pool in that the government would help create so that those folks would find a pathway forward when they're in their temporary situation until they can get out of it and afford health care on their own.
So does that mean that would everyone have to have health insurance, the mandate in other words, or would just people who don't have health insurance be asked to go into that pool?
Well, since we never really got to flesh out our ideas, I can't get into the weeds with it. But I think that what we were generally trying to go for is a system where people have to have the responsibility for their own health care. If they choose not to have health care and want to pay for it out of pocket, I think that should be their right. But for those that are in those situations where they're out of work, they have meager resources, and they find themselves in a place where they truly need health care, I think that we need to have a pathway forward for them, and that would be a temporary condition and a pool of risk where they can get the health insurance that they need, and obviously have to pay a portion of that insurance based on a number of factors.
Okay. Brad, Fred said something, I just want to give you a chance. He said something that, given the fact that you are a doctor, you may be skewed if you were elected to Congress, that you'd be overly concerned about the plight of doctors here, not the plight, the condition of doctors.
I'm more concerned, and I think all doctors are concerned about the relationship between the doctor and the patient being maintained and being able to carry that out. I really don't know any doctors that look at each patient and check their insurance and this and that. They make their decisions and take care of people in the way that they're supposed to be taken care of. The fact of the matter is that you want to have doctors able to take care of patients, and my concern is for those that are uncared for. We give away a lot of care whenever we need to. I get a list every month, which bills are you willing to write off?
I want to move on. President Obama recently proposed a reduction in the corporate tax rates from 35 to 28%, coupled with the elimination of dozens of breaks that are available. Fred, is this something that if you were in Congress that you think you could work across the aisle, and this is the basis for some sort of agreement in this revision of corporate tax rates?
Yeah, there's no doubt that I have the personality and the skills to work across party lines. We need to be able to work together. This is a shared power situation in Washington right now, so we need to bring our best skills in negotiating our side and not leave our principles at the door, if you will. So as I go forward, obviously corporate tax rates, the U.S. has the highest corporate tax rate in the world. I've envisioned in my tax plan, and I have the plan published in my bio and on my website, that talks about eliminating the loopholes, both personal and corporate. And once we do that, then we take a look at the revenues, and if we need to, then we maintain a flat rate. Now, I envision possibly a flat rate for individuals, possibly not for corporate, but we need to cut out the loopholes and then take a good look at the revenues. I think most Americans are sick and tired of all the corporate tax breaks that are going on in America, and we need to get back to a fairness in our tax system that is fair to all.